Well, I'd like to start by saying thank you. Thank you, Mr. Arlett, for having heard the voice of patients and consumers organization. We're really glad that you took our recommendations into account. And most of all, we are glad that with the new legislation, you gave all EU citizens the same opportunity to speak up and to be heard when experiencing side effects. So once again, thank you. Well, we heard it before. The evidence clearly show that patients can play an active role in pharmacovigilance and can actively contribute through an integrated and efficient reporting system. We hear all the time patient empowerment, consumer empowerment, but what does it mean? Well, if we want to translate this in practice, we can think to direct reporting as one of the tools to involve consumers and patients in the management of their own health. We know that with direct reporting, adverse drug reaction can be detected earlier, that more adverse drug reactions are reported, both in quantity and in variety, and that reporting which is unfiltered by healthcare professionals can bring an added value in contributing to the understanding of adverse drug reactions. For example, patients can use a vocabulary which is enlightening. When a patient withdraw antidepressant and report shock sensation, this is translated as paresthesia from healthcare professional, and this translates very little of the disabling impact of the withdrawal symptom on the patient. But I would like to add to the evidence and to the experiences we heard before, the experience of two of our members in Belgium and in Italy. In Belgium, our member Testa Shah has been collecting reports from consumers since 2006, reports about adverse drug reactions and other problems associated with the use of medicine, for example, in terms of availability or problems with the leaflet. And consumers were given the opportunity to report using an internet form or a paper form they could request using a phone line. This project is run together with the Belgian Medicine Agency. And the form includes a variety of information that goes from the name of the medicine to the demographic information. Of course, the Belgian Medicine Agency does the follow-up with regard to the adverse drug reaction, while my colleague in the consumer organization deal with the other problems raised by consumers. For example, I don't know how to take this medicine, or I cannot swallow because the format is too big. And in 4 years, they collected 900 reports. 78% of them were adverse drug reactions. And the results, I would say, are very interesting because they show, first of all, that the patient reporting is important to really understand what is the impact of the side effect in patients' everyday life. And in fact, they also asked patients to score the seriousness of the side effect, so that people could really say how this impacted in their life. And they also asked what actions they took when they experienced the side effect. Then this initiative showed that people tend to report side effects which usually are not reported to healthcare professionals, for example, psychological or sexual adverse reaction. They collected reports from OTC medicine, regarding OTC medicine, but also herbal medicine, homeopathic medicine, but also food supplement. They collected reports regarding unknown side effects. And again, it showed that consumer reports are correct, are detailed. And the last point, that this initiative raised awareness, at least in Belgium, about the importance of reporting side effects. Another example from our Italian member, Altro Consumo. Again, this project is an initiative of the consumer organization, but it's done in collaboration with the Italian Medicine Agency, and it's done via the website of the organization. The first example regards two creams to treat atopic dermatitis, two creams used as second-line therapy in the treatment of this problem, which can be prescribed only by dermatologists and should not be used for a long period of time and with extreme caution in among children. They asked who prescribed it, for what problem, the age of the patient, and other comments. And they ran this project from June 2006 to January 2009, collecting almost 500 reports. And again, the results are, I consider them very interesting. Well, the report, they found out that in 12 cases, these products were prescribed for an off-label use, that in 185 cases, it was prescribed as a first-line treatment and not as a second-line treatment as recommended by the competent authorities, that it was not prescribed in 51 cases by a specialist dermatologist, but by a general practitioner, that it was used, and it should not, also in children below 2 years, that it was used for a long period of time, and I would like to draw your attention on the last two indicators. They collected 140 suspected adverse drug reaction against the 14 cases reported from healthcare professionals in 7 years. The second example, we discussed it briefly yesterday. It's regarding isotretinoin, a treatment indicated for severe acne. Again, it could be prescribed only by dermatologists, and with extreme caution especially because it has a teratogenic effect. They asked the similar question: who prescribed it, for which problem, the age and the sex of the patient, the information that the patient received from the healthcare professional, the satisfaction with the therapy. And from April 2009 till September 2010, they collected 276 reports, showing that, well, if it was this product was prescribed also in some cases for moderate acne, not only for severe acne, that was prescribed as first-line treatment, so against the recommendation of the competent authorities, that the patient received, in some cases, little information from the healthcare professional in relation to the adverse effect, in relation to, for example, the impact on blood donation, because the teratogenic effect regards not only the women, but also the men, if they donate blood, for example. The doctor didn't inform the patient about the importance of reporting side effect, or they show that in some cases the monitoring of the treatment was not done as recommended in the guidelines from the competent authorities. And it also showed that in some cases patients experienced side effects, but they decided not to report to the doctors for a variety of reasons. And they collected 193 responses, adverse reactions, sorry. The conclusions are similar to the one from the experience of Testa Shah. Again, the patient is the one who is experiencing the problem, and that's why patients want to be heard and want to have a say in the drug safety-related problem, that patients report in a reliable and valid manner, and most of all, the patient reporting is useful to detect problems in the prescribing behavior of a healthcare professional in relation to abuses and misuses, which are not usually reported by healthcare professionals. But so what is the role in general for patients and consumers organizations? These experiences are very specific, but in general, I think that we as a consumer organization and patients organization have an important role to play in increasing awareness, in helping those who want to report side effects without passing via their healthcare professional to do so. For example, again, it's from our Italian member, providing on our website the official form to report with the recommendation to consult healthcare professionals, so the doctor and the pharmacist. With our Italian member also give consumers the opportunity to seek for help via their helpline, and also the addresses where to send the information. To conclude, the expectations. Well, what we expect from the implementation of the new legislation. We certainly expect user-friendly and accessible reporting system in all countries. We expect consumers to have the possibility to report not only via the online format, but also via other channels. We would like consumers and patients organizations to be involved in the definition of the concrete modalities of reporting at national level. We would like the general public, patient consumers, to be better informed about the benefit and the risks of medicine, and also about the importance of side effects. We would like direct patient reporting to be considered as a way to complement and not to replace the healthcare professional reports. And so would like healthcare professionals to receive incentive to report more and better. And with this, I think I will conclude. Thank you very much.
Thanks very much indeed. We remain on time, so if we have any questions for Ilaria from Book, yes, please, go ahead.
Well, I didn't catch which medicines you were talking about. You had the 14 and 140. Could you just say a little bit about that?
Yes, well, I think I can say the name. Elidel and Protopic were the two medicines that were used in that project. So people were asked to report side effects in relation to Elidel and Protopic.
Other questions? I thought your very last conclusion was very interesting. It's something that we must not lose sight of, and that is that we mustn't stop encouraging health professionals to report as well, because this is about better and more and enriched reporting, not patients instead of healthcare professionals. Yes. So I think that's something that we should hold on to firmly as we go forward. Any other questions for Ilaria? Please, right at the back, right at the back. Ilaria, you might not be able to see behind the pillar. Can you use your mic, please?
Technology. My name is Julie Musk. I'm from a user testing company, and I'm just interested in the point you raised about additional information coming out about the appropriateness of prescribing, and how you are intending, or how you would advocate using that information to encourage kind of best or proper practice in prescribing.
Very interesting question. How to use the feedback on good and best practice of prescribing, or perhaps dispensing as well, and how might consumer organisations or health or regulatory authorities use this information?
Well, I think that this information is particularly useful for the competent authorities. I think that in the case of Elidel and Protopic, there was an action taken by the European Medicine Agency with a Dear Healthcare Professional letter reminding healthcare professionals on how to prescribe the medicine, on how to monitor the treatment. So I think that this information it's useful for the competent authorities to send out then Dear Healthcare Professional letters.